Namaskar. Do your knees hurt while walking or are your joints stiff in the morning? Then there is a possibility that you may have arthritis. Over 180 million Indians today live with arthritis. That's almost 1 in 6 of us. Arthritis is your body's way to say that something inside needs balance. So, today, let's find out more about how we can manage this condition naturally. You must understand that arthritis means inflammation of the joints, but not all arthritis the same. Most common forms of osteoarthritis or OA and rheumatoid arthritis RA. Osteoarthritis happens when the cushion between bones, the cartilage, wears down with time. It usually happens as we get older and it is more common in the knees, hip, and spine. Rheumatoid arthritis, on the other hand, is quite different. It's an autoimmune disorder, which means the body's own immune system starts attacking its joints. And this leads to pain, swelling, and deformity. To manage both these conditions, I'm going to give you some guidelines on movement, anti-inflammatory diet, and also home care tips. Let's start with osteoarthritis. This is sometimes called as wear and tear arthritis. The first signs are usually pain when you move, stiffness after rest, and sometimes swelling. Climbing stairs or sitting cross-legged becomes difficult. I have seen that this condition can be managed very effectively with movements, because movement is also like medicine. Regular yoga practice improves flexibility, strengthens muscles around the joints, and reduces stiffness. When there is less pain, you can start gentle joint relaxation movement. Some helpful asanas for osteoarthritis are: for the hip joint, Yogendra Utkatasana with support, which will strengthen your hip and thigh muscles, reducing pressure on your joints. Yogendra Shalabhasana is good for improving circulation in the lower back and hips, so it reduces stiffness. Yogendra Bhadrasana will gently open your hip joints and relax your inner thigh muscles. Do Yogendra Pavanmuktasana to improve joint mobility. For the knee, you can do Yogendra Yastikasana for better alignment of your joints. Then Supta Vakrasana gives relief by reducing stiffness around the knees and back. Do them slowly without strain. Take the guidance of a trained yoga teacher. Don't force your body and stop if you feel pain. Now I will talk about food and home care for osteoarthritis later. For now, let's move to the second type, rheumatoid arthritis or RA. Unlike osteoarthritis, which develops gradually, RA starts suddenly with pain, swelling, and stiffness in smaller joints like fingers and wrist. Sometimes you may also feel tired or feverish because RA affects your immune system. So what can we do naturally for RA? During active inflammation, it's best to rest the painful joints. Once the swelling settles, you can slowly begin gentle exercises under guidance of a yoga teacher or physiotherapist. Some gentle asanas you can try during the recovery phase for warming up, like slow Yogendra Yastikasana. It will help improving blood circulation in your body. And remember, relaxation is very important for RA. Practices like Anulom Vilom, Nishpanda Bhav, and Shavasana help to calm your nervous system and reduce cortisol level. This will reduce any inflammation too. Rest is necessary, but take balanced rest. Too much rest increases stiffness, and too little rest increases pain. Now that we have seen both types separately, I will tell you some common holistic remedies that help in both conditions. You may also visit the Yoga Institute during Samatvam on Saturday for personalized advice from our experts. You see, what you eat can either remove inflammation or increase inflammation. You must understand that anti-inflammatory foods reduce your body's inflammatory markers like C-reactive proteins. This eases joint swelling and slows down cartilage damage. So have anti-inflammatory foods like ginger, turmeric, methi, flaxseeds and amla. Avoid deep fried snacks, refined flours, excess sugar or red meat. All of these increase inflammation. A warm, home-cooked sattvic diet is best if you have pain and swelling. A simple remedy is to take a teaspoon of turmeric with black pepper in warm milk at night. This is especially helpful for osteoarthritis. Small lifestyle changes are required if you have arthritis. Walk in morning sunlight to strengthen bones. Take warm water for bath. And yes, weight management is very important, especially for osteoarthritis. Even losing 5 to 10% of body weight can make a visible difference in knee pain. It's essential to keep your mind peaceful. Practice abdominal breathing, shavasana or meditation. Reflect on Anitya Bhavana. Remember that everything changes, even pain. So managing arthritis naturally is not about a single cure. It's about a balanced lifestyle. Remember, arthritis is not the end of movement. It's a reminder to move differently. Namaskar.